It's time for a lesson in female anatomy. We're going to talk about the difference between a vagina and a vulva, where you can find the clitoris, and why it's important to know that we have 3 holes down there. The vulva is a term that's used to describe the entire region of the female genitalia. It extends from the mons pubis, which is the area in the front covered with pubic hair, all the way to the anus. It also includes the labia majora, the labia minora, the clitoris, the urethra, which is the pee hole, and the vagina. There are also some glands in there that are important, including Skene's glands and Bartholin glands. Lastly, the vestibular bulbs, which kind of go along with the clitoris, which we'll talk about in a minute. Within the vulva, there are 3 different holes: the urethra, which is the pee hole, the vagina, and the anus. It's important to know there are 3 holes for a couple of reasons. 1, period blood comes from the vagina. It is possible to wear a tampon or a menstrual cup and pee at the same time. The other important thing to know about these holes is that the urethra and the vagina are actually pretty close to each other. When someone has penetrative vaginal sex, that introduces a lot of bacteria to the area around the urethra as well. This is a setup for a potential urinary tract infection. This is why we recommend peeing after someone has penetrative vaginal sex. It flushes out all of that bacteria that might cause a urinary tract infection. What do normal labia look like? Whatever you have. Labia come in all shapes and sizes. They can be very small, they can be very large, they can be lopsided, sometimes they can be wrinkly, darker in color, or lighter in color, but all labia are normal. When we're talking about the vagina, it's also important to talk about the hymen. For most people, the hymen is a thin piece of tissue that surrounds the vaginal opening. Sometimes it's a little bit larger, and sometimes you can barely see it. Many people wonder, what about the hymen with their first time having penetrative vaginal sex? Sometimes the hymen won't be an issue at all, and sometimes the hymen will tear, bleed, and might cause a little pain. Everyone's hymen is a little bit different, but everyone's hymen is normal. Let's talk about the clitoris. The clitoris is a very important part of the vulva. It actually has a little piece of tissue that is on the surface, but a much larger body that extends underneath the skin. The part of the clitoris that can be seen or visualized in the vulva is the glans clitoris, or the head of the clitoris. This is sometimes covered by a clitoral hood, which is formed from the 2 labia minora meeting up. The body of the clitoris extends from the glans down around the sides of the urethra and the vagina, kind of like a wishbone. And why do we care about the clitoris? Because it's the main source of sexual pleasure for those with female anatomy. In fact, the head of the clitoris alone contains up to 8,000 nerve endings. We covered a lot in this video on the vulva, and I hope you enjoyed. If you want to learn more, please subscribe to our channel. And if you have questions for us, you can leave them in the comment section below. Thanks for watching.